Okay, we're back from that short break, and thank you again for tuning in tonight. I'm your host, Dr. Michael Reiner of the Independent Doctors of Pahrump. And before we were talking a little bit, finishing up the hypertension study or the hypertension discussion, and we were talking about beta blockers, and then Ray called in about his cold question, and then we had Bonnie call in regarding cancer treatment, and certainly great advances are being made. And obviously, you know, I have patients I've seen a lot of patients who get cancer, and I have one patient who basically developed a strange form of cancer, sarcoma, which is very rare, and she felt like she had done something wrong in her life to deserve that, and I've tried to get that message across to her that a lot of people believe that cancer is just bad luck, that some cell mutates and things bad happen. Other cancers are actually as a result of some exposure and things of that nature. So I think it's your right as a human to do whatever you want to your body. I do believe that eating right, eating the right foods, getting rest, and trying to avoid those things that we know cause cancer will help to reduce your risk of getting that. And that being said, I will tell you this: if you drink and smoke, it's not will you get throat cancer, it's when will you get throat cancer. So 100% of the people who drink and smoke will get throat cancer if they continue to do that. So those people that do that together, I want to let you know you will get throat cancer, okay, if you don't succumb to some other cause as a result of those activities. So, you know, you do make choices, and we do have to live with those choices, but for the most part, those behaviors will lead to some adverse effect if you continue to do that. That's why I've been talking about diabetes, because I think diabetes is probably the #1 disease out there that affects so many different organs and affects so many different things in our body. And as our population is aging, we are not dealing well with the sedentary lifestyle and the overabundance of food. That being said, I heard recently through a continuing medical education talk where somebody was talking about the fact that if they could just walk a mile after each meal, that would greatly reduce your ability to get diabetes by walking after you eat. Not before you eat, but walking after you eat, because your muscles are burning off that sugar and you are actually reducing its ability to be incorporated into fat, and that's a very important factor. Okay, so back to the diabetes, back to the hypertension model. I didn't really have a computer that would bring that up, but we managed. Hopefully we can bring up this one slide, which talks a little bit about the different types of beta blockers, and again, the selective, non-selective beta blockers. And if that comes up, we'll look at it. Yeah, there it is. So these are the non-selective agents, and what that means is they do not select for one particular tissue or the other. They will affect your lungs as much as they will affect your heart, and you may be able to see that you were on that one of those particular products. And then we have the selective beta blockers, and we'll hopefully bring that list up. And these are selective more for your heart. Let's see if we can go to there. It is. Okay, so they were called beta-1 selective. They are cardioselective, and some of these are actually more selective than the other ones. The one I tend to like the most is basically the one at the bottom, which is basically a newer drug, but it's Vistolic, and it's a very, very good product. It also increases nitric oxide release for vasodilatation, and nitric oxide is a very important thing for your heart and a lot of other tissues. A little more expensive than some of the other ones. Bisoprolol up there is a very good product also, and atenolol being not so beta selective, but if I had to choose one of those, I would choose basically Vistolic, which is the one at the bottom, and then I would look at bisoprolol. Those are my two favorite in the cardioselective. So if you have COPD or some lung condition, asthma, something along that nature, and asthma is a very specialized medication. If you have asthma, I would really talk to your pulmonary doctor or your healthcare specialist about using beta blockers because you may need a rescue inhaler, which is basically a beta agonist, and it might not work as well as you need it to. So asthmatics are cautioned about beta blockers as well as antihistamines. Okay, that being said, we will move on to another subject that I really wanted to talk about, and I'll start it on this show and probably continue on the next show, which is immunizations. A lot of people ask me about the shingles vaccine, which we know has been out now for quite a few years. And I want to talk a little bit about the actual shingles rash. I don't have a good picture of it, but it is a grouped form of blisters, red vesicles or little bitty blisters on a red base. So imagine that you had this like red piece of tape and you spotted little bitty blisters on it. That would be shingles. The identifying part about shingles is that it is only on one side of your body. It will not cross over the midline of your body, and that is because the virus lives dormant in your body. This is called the Varicella-Zoster virus, the same virus that causes chickenpox. So as a result of getting chickenpox, okay, you now have the ability to get shingles. And it lives in the dorsal ganglia, which is a nerve root in the back of your spine, in the base of your spine. So what we call dermatomes, meaning every vertebral body has a ganglia, which has a nerve root that branches out and goes around your body. So therefore, if that virus, let's suppose for some reason you get a sunburn or you get some irritation in one part of your body, okay, and that causes the virus to grow, then what will happen is the virus will start to grow in that particular nerve root, or what we call dermatome distribution, or that section of the skin which is innervated by that particular nerve. And you will start to feel pain, burning, and that sensation and that thing long before you get blisters, long before you get any signs of if you've ever had shingles. And a lot of people miss that diagnosis. They will have this pain in their back or in their side, and they don't know how they hurt themselves. They won't know anything about it. And it's a burning, it's just some deep ache that they're getting, and then the next thing you know, several days later, they have this florid rash. And now they have shingles. And while shingles is not a life-threatening virus, it can be in rare conditions to immunocompromised patients, because the reason you will get shingles or not get shingles is, first of all, you have to have the chickenpox virus. But let's suppose you never got chickenpox, or you had a subclinical case when you were a child and don't remember that. If you never got chickenpox and you get exposed to the chickenpox virus later in life, it can be deadly, and it can cause a varicella pneumonia or a viral pneumonia, which has a high mortality rate. So it is important when you're going to the doctor. One of the tests you might want to look at is called a Varicella Igg, or an immunoglobulin. It actually tells you how immune you are to that virus. So thank you for my show producer who actually put that slide up there, because he was thinking. And so again, look at that Varicella-Zoster Igg. That is the test that you want to look at, and that is going to tell you what your immune level is. How much antibody do you have in your body? If you're at the normal values are 0.9 is equivocal. So someone who has a 2 or a 3 level in their body is pretty immune to shingles and probably may not get an outbreak. But if you're at 0.9, okay, or lower, then you're likely to get an outbreak. So this is one way that you might be able to tell that. And I caution people against using that only manner, because as you get older, your ability to process this particular or re-up your memory, so-called, or your memory of the virus, gets a little bit harder as you get a little bit older. So one of the things that is important about that, if your immunity is low, or if you just decide you want to get the vaccine, it's important to realize that it will not prevent the shingles outbreak, that you could still get it even though you get the vaccine, but it will make it less of a problem for you. And the reason you want to get the vaccine, if you decide to do it, is that there's a problem with the damage to the nerves as a result of the virus causing a post-herpetic neuralgia. What does that mean in English? Post meaning afterwards, herpetic meaning herpes virus, and I know it's chicken pox is what they call a member of the Herpes-Zoster virus, and then that doesn't mean it's herpes, but it has a protein on, it has a similar like protein capsule, and it's a member of the zoster or that virus. So is mononucleosis. It just defines the protein capsule is really all it defines. So because of that, basically having that particular post-herpetic neuralgia, meaning pain in the nerves. So if you have a severe outbreak, you are going to get a lot of chronic pain. So we're going to have to close with that thought, but come back next week and we'll talk more about post-herpetic neuralgia and other vaccines, which may be very useful at a later stage in life or at any part in your life. Again, thank you for tuning in tonight. See you next week.